The X-ray that is shown in my background is the X-ray that you will have on your Viva table during your later half of your exam, that is table Viva. So normally the questions that are asked is to interpret this X-ray. What is the abnormality that needs to be treated immediately in this particular X-ray? Can this occur during anesthesia? Is nitrous oxide safe to use in this patient if this patient is undergoing anesthesia? If yes, why? If no, why? Why does the patient experiences cardiovascular collapse? And you may also be asked to give 3 reasons or causes for this problem. Right, now let us break this into simpler way. Now, how will you interpret this X-ray? Apart from reading it from step by step, which I will not go into detail, the most obvious abnormality that you see is a large right-sided pneumothorax with mediastinal and a tracheal deviation to the left. Now, the other abnormality that you see is the tip of the endotracheal tube, which is at the carina and which needs to be pulled back a bit. That is the number 1. Now, which abnormality needs to be treated first? Obviously, it is the pneumothorax that needs to be immediately attended, because it should not go into a tension pneumothorax where there is decreased venous return, decreased cardiac output, patient faces hypotension and then collapse. Right? Now, can this occur during anesthesia? Yes, pneumothorax is a recognized complication of positive pressure ventilation. Now, is nitrous oxide safe to use in this patient? Definitely no. The answer is no, it is not safe. The reason is because nitrous oxide diffuses down into the concentration gradient from the blood back into the pneumothorax, leading to increase in its volume and pressure within the cavity, exacerbating any tensioning effects, right? And why the patient experiences cardiovascular collapse. Whenever there is a pneumothorax, the venous return would be reduced due to the increase in intrathoracic pressure. The cardiac output would fall and result would be profound hypotension with a compensated tachycardia. If not treated, the patient will collapse. And the last question is the 3 causes for this problem. Yes, it could be primary spontaneous pneumothorax, it could be secondary spontaneous pneumothorax, trauma or iatrogenic. When we say primary spontaneous, that is in the absence of any underlying disease. Secondary spontaneous occurs when there is a known lung disease such as tuberculosis, COPD and malignancy. It could be trauma, that is penetrating chest wall injury, rib fractures, blunt trauma. And it could be because of iatrogenic causes like intermittent positive pressure ventilation, central line incisions, nerve blocks, particularly the supraclavicular nerve blocks. Thank you everyone for watching this. I welcome you all to barcdrazam.com. Thank you so much and happy learning. Bye-bye.